He's taking a picture. Look at the nose.
One February night, a simple Skype call turned into a horror that will reverberate in my mind for the rest of my life. My mom loved to video call my 9-month-old son, but that night she saw him make an odd face. Due to her medical background, she questioned it to be seizures. Upon confirming with a neurologist, my son was having over 10 seizures per day and was diagnosed with epilepsy. These seizures progressively got worse as the days went on, and we fought to attempt to diagnose the cause and control the seizures through medication without any breakthrough. Intractable epilepsy with no diagnosis and a lack of proper anticonvulsant medications to control these seizures so these individuals can attempt to live a normal life is all too common amongst children. After researching the subject, I've come to agree that cannabis oil, or CBD, should be just as much legal as other prescription seizure medications for children strictly diagnosed with epilepsy across the United States. I know that any association with marijuana is controversial and that most of you may oppose such a plan due to the derivative of cannabis oil, but I ask you to listen with an open mind while we discuss the lack of natural medicine to control epilepsy, benefits of cannabis oil, and a plan to help legalize this for any child diagnosed with epilepsy. Although there are various medications to attempt to control seizures, all come with numerous side effects that will negatively affect the individual who may already be dealing with daily medical turmoil. According to the Realm of Caring Foundation, despite constant but interval advances in anti-epileptic drugs, pipeline development, a large unmet need still exists for therapies to address medically refractory epilepsies. Although many reject the legalization of CBD oil, people may make rash decisions on such an important matter because it simply comes from marijuana without having educated themselves on the makeup of cannabis oil. Epilepsy patients seeking this form of treatment are interested in the strain of high amount of cannabis oil and the lowest possible amount of THC, which is the part of marijuana that makes a person feel high. The THC in the strains approved for children with epilepsy are so low that it has absolutely no effect on a child. Cannabis oil is no more marijuana than rope that's made from hemp plants. Cannabis oil has been proven to have enormous benefits for the patient. According to the Realm of Caring Foundation, CBD is a non-psychoactive compound that has been shown to have anticonvulsant properties in a number of animal models of epilepsy. In human trials, CBD has shown promise as an anticonvulsant with very few negative side effects. This chart is a depiction of the side effects normally listed for anti-epileptic drugs opposed to those when reported on cannabis oil. This shows the side effects, the percentage of people that were affected with CBD and then other anti-convulsives drugs. The results from this testing group of the positive outcome reported a very little side effects comparative to traditional anti-epileptic medication is outstanding. A second revelation is the significant reduction in seizures when utilizing cannabis oil versus traditional drugs. The Realm of Caring Foundation stated that of the 19 patients within their study, 16 reported a reduced seizure frequency during CBD treatment, and 3 reported complete seizure freedom during treatment. Thirdly, cannabis oil has been known to be effective in numerous debilitating conditions. These include cancer, glaucoma, HIV or AIDS, persistent muscle spasms, seizures, severe nausea, severe pain, and migraines. Lastly, the remarkable results of CBD oil are undeniable when you hear testimony from just 2 families and the life-changing impact this treatment had. Charlotte's Web is one of the most well-known indications of how life-changing cannabis oil can really be. This is recounted by Charlotte's mother, Paige, of her daughter finding treatment through CBD when interviewing with NBC News. Her daughter, Charlotte, had Dravet syndrome. Paige says Charlotte had tried and failed every anti-epileptic drug by the time she was 2 years old. A friend put Paige in contact with Joel Stanley, a medicinal marijuana grower. Stanley and his 5 brothers grow medicinal marijuana in Colorado, where it is legal. Together, Paige and Joel made an oil from a cannabis plant that's low in THC and high in CBD. Charlotte had been having over 300 seizures per week. Paige says that they stopped when she gave her the CBD oil. To this day, all Charlotte takes is 2 doses a day of the oil. The Stanley brothers have now built a lab and are making the CBD oil on a large scale in Colorado. They call the CBD oil Charlotte's Web, named for its first user. Haley is another child who had uncontrollable seizures, and a strain of CBD was named after her, Haley's Hope. According to Jason Cranford, the founder and operator of the Hope Foundation in Colorado, Haley is a 4-year-old who has cerebral palsy and Lennox-Gastaut syndrome, which is a form of epilepsy. She and her mother had become refugees from the state of Georgia and had moved to Colorado to receive cannabis treatment. In 2 weeks, she has gone from 200 plus seizures a day to as few as 4 a day with the cannabinoid-based medicine designed specifically for her. The strain this medicine was derived from was dedicated to her and named Haley's Hope. This strain was bred over a 4-year period using hundreds of phenotypes of the highest CBD and lowest THC compound to create her medicine. For patients such as these 2 young children, cannabis is the only treatment to control their seizures, and they cannot be controlled any other way. Witnessing the dramatic turn of events from such a difficult way of life day in and day out to the freedom this natural treatment gives families is astounding. Developing a call to action utilizing 3 major points will hopefully allow this miracle drug to become legal. First, we need to educate families that aren't affected by epilepsy. Many people are against this treatment simply because they aren't informed properly about cannabis oil. It is a very common misconception that this treatment is allowing the child to get high, which is far from the truth. Secondly, we need to raise attention to the benefits of such treatment and the testimonies of families that have utilized cannabis oil. In combination with the decrease of seizures, minimal side effects, and amazing reported results, the legalization of this as an equivalent of other seizure medications is justified. Lastly, cannabis oil needs to be addressed as a separate issue from medical marijuana. The 2 treatments are completely different in that cannabis oil is taken orally and with little to no THC, whereas medical marijuana has high amounts of THC and is usually smoked. Parents of children with epilepsy, such as me, have been put in the frustrating situation of having to watch children in states that marijuana is legalized take cannabis oil and have amazing successes, yet we are subject to the law of the state of Texas and cannot utilize this to potentially cure our child. This leaves the only option to the parents of uprooting their family and moving to these marijuana legal states that are because they are desperate to get their seizures under control. Some may argue that although there are minimal side effects for short-term use, the long-term hasn't been able to be studied due to the upcoming discoveries. I know many parents with children such as Charlotte and Haley feel as if their child won't even live to the long term without the help of something to relieve the seizures. Therefore, we are willing to take this risk for majorly positive. Within this speech alone, a child has had one of many seizures they will experience today, or suffer side effects from traditional anti-epileptic drugs. For example, my son Colt is on traditional seizure medicines twice per day, and although still nonverbal, he has side effects that we can visually see on a day-to-day basis. Informing society on cannabis oil, raising attention to the benefits and success stories of CBD, and addressing this legalization separately from medical marijuana should significantly impact cannabis oil being legalized for all children diagnosed with epilepsy. Educating fellow parents and lawmakers on the legalization of cannabis oil could ultimately give numerous children, including mine, a chance at a normal life. Thank you.